Oh, good morning, and thank you. I don't know what else I can add. As I sit and listen to everybody else, it's kind of hard to add a whole lot of additional true information. So I'm gonna take a little bit different slant, if I may. Um, I walk into the emergency room just about every morning. What is different now compared to what we saw in August or even this time last year? It's wall-to-wall stretchers. We have no capacity left at the hospital, and I don't think we're unique in that. This particular variant has been overwhelming to the healthcare systems. We have more patients than we've ever had. We've exceeded our previous peak by over 100. And on a daily basis, we continue to admit patients who are infected with COVID-19. One of the myths that we keep hearing is that, well, it's not that serious. Well, perhaps it isn't for some folks who are lucky, but COVID-19 is having a tremendous impact on underlying health disease. And so those patients who have other diseases such as heart failure, diabetes, sickle cell anemia, who are immunocompromised, if they get infected, they get incredibly sick, much more than they usually would get sick, and they wind up in the hospital. So when you hear that we're not seeing as many severe illnesses related to Omicron, perhaps we're not seeing as much Omicron-related COVID pneumonia, but we are seeing an overwhelming large number of patients who are ill, and that is caused by this virus. What impact is it having? Well, aside from being overwhelmed with patients, and we are running about 110% capacity right now. We've had to divert ambulances over the last several weeks because of the huge number of patients coming in. That has a big impact on the rest of the city. Grady is the trauma center for Atlanta. And when we have so many patients waiting in the emergency department for beds upstairs, we have to divert ambulances at times. This is not good for our community. It has a terrible impact on our patients who need to come here for the services that we are so well equipped to provide. We, continue to deal with the fact that our staff is impacted by this, not just because of the fatigue, the frustration that you heard about earlier, but they too are getting sick. And it's not because they're not doing things properly. It's because they're in this environment and they're in the environment at home. And so they become ill. When they're not here, our staffing goes down. So that adds additional stress to the remaining staff. This is a real interesting time because everybody's tired of talking about this. It's only been 2 years. I think today is the 2-year anniversary of the first case in the United States. We met in August to talk about this. Little did we think we would be talking about it again today, but here we are because a new variant is out. We've got to continue to do all those things that we've heard about earlier. But I also think it's time for us in healthcare to take a little step back and assess our role in this and some of the confusion. This is an evolving disease. 2 years into it in the United States, a little over 2 years worldwide, we continue to learn. And so a lot of times the information that comes out is different from what you heard earlier. And we need to take responsibility for that as healthcare providers because we need to admit what we don't know. We need to admit what we are still learning and provide the best information possible, but provide it in a way where people understand that we too are still learning what's going on. What's the future? We still are in this highest peak that we've had. There are people saying that it's getting better. We haven't seen that at Grady. We're at a plateau level. It may be improving in the next week or so. We're hopeful for that. But then we have to be ready because this isn't going to go away. COVID-19 isn't going to disappear after this wave. There will be other variants. I think we can assuredly say that. And we've got to continue to do those things that we know help. And you've heard about vaccines. I'm not going to reiterate all the things that have already been said. All I can say is use good sense, be smart. We know what we can do to help prevent this. And the other thing is, early in the pandemic, we had the heroes, the health heroes, and everybody was out banging on pots and pans. Well, now healthcare doesn't feel like heroes anymore. But we got to continue this, and I don't want us to become victims either. So keep doing what you know works. We're here to help when we can, but do understand this is real. This has been an overwhelming peak on top of an already fatigued staff. And I'm going to turn this over to Dr. Matt Pilley from Northeast Georgia.